American Heart Association calls high blood pressure a silent killer.
Also known as hypertension, high blood pressure most of the time has no obvious symptoms, leaving the long-term effects of the condition even more dangerous. Here's Intermountain Healthcare.
The interesting thing is hypertension is a silent condition. So most patients who have hypertension don't really know they do until they get their blood pressure checked. There can be symptoms when the blood pressure has been elevated for many years, but that usually results in severe complications such as heart disease, stroke, kidney injury. You can have trouble breathing, you can have headaches, changes in your vision, chest pains, palpitations. All of these are signs that you should be evaluated by your primary care physician and have your blood pressure checked and see if there's any other issues that may come up. Generally, when we think about high blood pressure, we think that anything below 140 systolic and anything below 90 diastolic is considered to be normal. So anything above that would be considered to be hypertension. Generally, when we think about the top number, that's our systolic blood pressure. That's when our heart is active and compressing the blood to flow to the rest of the body. The diastolic number is when the heart is relaxed. And so generally, patients may think that if the bottom number or if only one of the numbers is high, they don't have high blood pressure, but that's actually not the case. If either number is elevated, there is a reason to be concerned and a reason to be evaluated for that. There are a lot of other risk factors, and we call them modifiable risk factors. That's things like weight, diet, and level of exercise. All of these can also influence whether your blood pressure is high or not. When it comes to hypertension, there are many medications that can be offered, but first we always ask our patients to do lifestyle changes, and these are noted to be very effective. And these involve things like having a heart-healthy diet, getting adequate exercise, and also controlling your weight, because all of these are risk factors. One of the main culprits in our food is salt. The American diet is very high in salt. A patient who has hypertension, their daily limit is somewhere between 1,500 milligrams of sodium to 2,300 milligrams of sodium. However, many patients are surprised to learn that 1 teaspoon of salt has more than 2,300 milligrams in it in itself. So diet becomes a very important part of controlling high blood pressure. This is the reason why it's very important to have regular follow-up with your primary care physician. And at My Generation Senior Clinics, we tailor our practice to the 65 and plus age group. What makes us different is that we are able to spend more time with our patients. We have a lot more dedicated resources that we can utilize to help our patients meet their healthcare needs and goals. We recommend seeing your physician at least once to twice a year, and that should be enough to get a good baseline for how your blood pressure is doing.